Okay, so hey everybody, welcome to Cheyenne County for those of you who are joining virtually, and a huge round of applause for those who are in Cheyenne County today. Woohoo! We have some really exciting things that are happening throughout our county here in Cheyenne County, Cheyenne Wells, Kit Carson, Arapahoe being represented. And we're also doing a lot of amazing things within our state in terms of launching our statewide cancer plan, which is really going to be essential. So I'm going to have our team say a few things about the coalition and community campaign that will complement this as well. And then we'll be talking about these plans that will really help impact our communities, our state, and how they fit together, and how we're really focusing on rural and frontier communities in our work. So Allie, would you like to introduce?
Sure. I'm Allie Bain. I work with the American Cancer Society, and I'm also the current chair of the coalition.
Great. Autumn?
Autumn Pelton, I'm the Communities That Cares coordinator here in Cheyenne County with the local public health and also the prevention coordinator.
Wonderful. All right, so I do think that we have Christy Cahill who's joining us also, Reese, from the Colorado Cancer Coalition. We'll have her jump in after we start just giving a quick introduction of our work today.
Do you want to introduce yourself?
Oh, yes. I thought I went without any introduction, being the loudmouth that I am. Hi, everybody. I'm Andy Dwyer. I am the outgoing chair of the Colorado Cancer Coalition. I'm faculty at the University of Colorado Cancer Center, the Colorado School of Public Health, and I am a Cheyenne Wells native. So I'm very excited to be here today. Are we no-go? Okay. So we're going to go ahead and talk a little bit about our presentation in terms of the work and why we're really here in terms of focusing on Cheyenne County. Can I, Travis, have us advance to the next slide? Okay. So we're really going to, again, be focusing on our statewide cancer plan, as well as really looking at that opportunity to connect with Kelly and Autumn and all of you for our local public health initiatives here in Cheyenne Wells and Cheyenne County at large. So what I want to say, Sally Dwyer, who's not here just yet, she asked me a really great question when we first started our campaign and thinking a little bit about doing additional work in Cheyenne County. We're going to talk a little bit about this isn't just a one-shot wonder in terms of our work here. We're going to talk about how we integrate local and statewide initiatives and how even if Allie and I and our team continue to focus on other counties throughout the state, how we're going to still continue to support Cheyenne County at large. So Allie, I'm going to pass it over to you to talk a little bit about who is our Cancer Coalition. Then we'll talk about, again, that initiative specific here to Cheyenne County. And then we'll talk about our state cancer plan, your Communities That Care grant, and then how you all fit and how we're going to continue to nurture this work. So Allie?
So the Colorado Cancer Coalition is much like you folks. We are a group of people from across the state that care about cancer. So it could be people working in cancer, cancer survivors, people that have been affected by cancer, cancer advocates. And so we all come together to coordinate efforts, collaborate on projects, and really reduce the burden of cancer in Colorado. Next slide. So this is our mission. I know the folks in the room definitely can't read this, but we really see ourselves as nonpartisan, multidisciplinary. We work to educate, to network, and to really share resources across the whole state. And then we also really try to make sure that we are providing support for survivors and folks that are going through cancer treatment.
Okay. So we're going to talk a little bit about the Coalition and Communities campaign. So as Allie mentioned, she's the current chair of our State Cancer Coalition. I'm the outgoing chair. We have additional leadership coming forward to really think about really promoting all of those initiatives from prevention, early detection, treatment, and survivorship. But one of the things that we had chatted about, and since I've been involved in the cancer work for almost 20 years now, is how do we get rural and frontier communities really represented, engaged, and really the resources coming out. So what's interesting is about 6-8 months ago, my mom and I were talking, and it was just at the time where we had to make strong tax deductions, right? Everybody's looking at your tax return or looking at what your income. And my mom and I were talking a little bit about, this opportunity to support rural and what was happening in the state. And then she brought up the idea that Keefe Memorial Hospital really is in need of a new mammography machine. And I started thinking like, well, we could all donate, we can all give charitable contributions to a lot of different things. But what I'm really interested in is supporting my hometown, supporting cancer initiatives. So we started talking a little bit about how to really do this work, which then had me making a lot of phone calls to Allie, to Christy Cahill, who's our leadership and our executive director, who's joining us today, to say, why don't we think about doing more of this work, really promoting the resources in rural health, for cancer prevention, for support. But maybe rather than trying to bring people in, we go out as a way to bring people in. And so we started to have more and more discussion about how do we do that. And we launched the Coalition in Communities, where we are going to, again, as I mentioned before, target 1 to 2 counties going forward every year to really look at the initiatives that we need to do to really elevate. So Keith Memorial, the addition of a new mammography machine. I think right now we're at about 50,000 in. I think the coalition has probably helped support a third of that amount. We'll talk about some of the other initiatives, but that's where this really grew. And I think to my earlier point, Autumn, Allie, myself, we're going to continue to work on our initiatives all throughout the year to think about how does local public health, how does our cancer plan really fit, and how do we make sure that both plans and all plans represent what you need and really help support with real resources. Next slide. So I think this has come up, and I used this slide when I was here and we were here for Hospital Week, but how many people would raise your hand if you feel like we have a lot of cancer in our community? So raise them high. Okay, we've heard that. Next slide. The reality is that this is true. So even the people in the back, Lacey, there you are, I see you, woo, woo. Okay. What you notice here is that over Cheyenne County as well as Jackson County, what do we notice about those? That's right, because it's dark and we're some of the highest rated, highest rates in terms of our cancer cases. So ultimately, cancer is a reportable disease. The statistics are out to help us really think about what resources, what's going on with the health of our communities. The state health department does a wonderful job of providing us resources and data. But this map really does represent that for all types of cancer, Cheyenne County is the second leading county with the highest amount of cancer rates that are detected. And then ultimately, if this is age adjusted and we look at what the state averages, our rates are almost double. So that's another reason that we're here, the resources, really thinking about what's happening and where we're going. So that feeling like that it's happening a lot here, it is true, and there's data to support this work. Next slide. So what I just want to say, and I'm going to hand it over to Allie to talk about the launch of our state plan, which is huge. This is one of the first and only times we've actually launched our state plan in a rural and frontier community, and the rest of the state gets to watch virtually. That's usually rural and frontier watching, and we're in Denver. So a little bit of that flip-flop that we talked about. But some of the things that we're really interested in hearing is from all of you, just like Autumn's campaign, listening. What are the needs? So we know that the mammography machine needs updated. We know that there's definitely some shortage of specialty care. We also know that in terms of supporting survivors, as well as those that need resources, that's an area that we've heard as well. We have some ambassadors who are really coming from our community to share your needs and interests. Raise your hand if you're an established ambassador in Cheyenne County for the outreach and awareness. Hi, raise them high, sparkle fingers.
Yay.
Woo! All right, yay, yay. And then we're going to continue to support the Cancer Walk, Keith Memorial, and Prairie View Resources. I would say Debbie Knutson with the grant writing. We've been really trying to help support that work. Kathy, Maggie, Debbie, Jasmine, several of you in this room, Nick Hebner, are on the phone almost weekly, spending an hour, hour and a half thinking about how do we support our work. And then ultimately, we're just going to really think about these ongoing opportunities to connect. So again, we're hoping to really connect with Autumn and the team. We can do grant writing together. Allie and I both work at the national level and international level, and we can really help bring those resources to our own hometown. So with that, I will turn it over to Allie to talk about our state cancer plan. And again, many of you, thank you so much for being here. This has really been awesome. We have made considerable gains in just a short 6 months. So good work to you all.
Does that work?
Yeah, sort of. I don't know why I passed
That's
it when it
fine.
kind of doesn't work. So here you are.
Keep going.
It's a literal passing of the baton.
All right, so now that Andy gave you the bad news, I'm going to give you the good news. So every 5 years as a state, we come together to develop a cancer plan. And what the cancer plan does is it talks about what we need to do to reduce the burden of cancer in Colorado. So we know that people should quit smoking. Well, how do we do that? We know that people should wear sunscreen. Well, how do we do that? So we look at all the evidence, all of the research, and pull together experts in all of these areas to figure out what we can do. So this is a little bit hard to see in the room, but this is kind of a timeline that we have of all of our cancer plans. So our first cancer plan was written in 1996. So by 2021, we're getting pretty good at it. Today we're here to launch our 2021 through 2025 plan. Whoops. Oh, it worked. Can you go back one, Reese? So this is our new plan. Ta-da! So in the plan, we have 9 different goals that we're working on. So 4 of them are related to prevention. 1 of them is related to screening and early detection. 2 are related to treatment. Number 8 is survivorship and end of life. And then number 9 is cross-cutting. So that's kind of the things that don't fit into a specific bucket that we need to be doing across everything. And so as you can see, this really covers the whole, what we call the cancer continuum, from preventing it to finding it early, to treating it, to taking care of our survivors. And then much like Andy was talking about, these are the top cancers in Colorado. So we see the breast, prostate, lung, colorectal are kind of our big 4 by incidence or by detection. And then for the death rate, we see that lung cancer is by far the highest, followed by prostate, breast, and colorectal. So like I mentioned, the cancer plan is divided up into sections. And so in our prevention section, we cover tobacco, healthy behaviors such as eating healthy and being active, clinical interventions to prevent cancer. So, the HPV vaccine, the hepatitis vaccine, what are things that we can do clinically to prevent cancer? And then decreased environmental exposures like radon. And so what we do is within each of those topics, we create an objective, and then we provide solutions that you can implement in your community to address this goal. So this is an example of exactly what Autumn is doing. So promoting quitting and successful quit attempts for people that use tobacco. So Autumn's going to talk a little bit here in a second about the things that she's doing that aligns perfectly with our strategies. And then also, we have the sun bus here this week. And so another thing is to decrease exposure to UV radiation. So we know that that will decrease skin cancer. So that includes the use of sunscreen, not using tanning beds, and again, some solid strategies that you can use in your communities. And then this is just really pretty. So this is kind of a comprehensive look at what we can do to lower our cancer risks related to lung cancer. So we know that people should quit smoking. There is lung cancer screening available at Keefe Memorial. So if you are a smoker and you are over 50, you should talk to your doctor about lung cancer screening. And then another thing we talk about in the plan is health disparities. So as you guys well know, there's different factors that can affect the proportion of people that get cancer. So we know insurance status, access to care, living in a rural area can all be contributors to an increased cancer risk. And then finally, the thing that all of us are tired of talking about, COVID. So whenever the world was kind of shut down, no one was getting cancer screenings. So we saw mammograms decrease by 87%, colonoscopies decreased by 90%. And so that doesn't mean that people weren't getting cancer during COVID. It just means that they weren't getting screened. So now we're playing catch up to try and get everybody back in for screening so that we can find all those cancers and get those people the treatment that they need. Off to Autumn.
This is exciting. Okay. I know, hopefully. I'm going to hand it back if I don't. All right.
Yeah.
So Cheyenne County's Communities That Care is funded by the Community Organizing for Prevention grant from CDPHE, which is Colorado Public Health Department and Environment, something like that. I almost got it, Kelly. I almost had it. I speak acronym. You don't have the touch.
I don't have the touch.
Okay, so Communities That Cares. Okay, so Communities That Cares is a 5-phase system change. So they were talking about getting the coalition up and running. The purpose of this work is to mobilize the community to begin prevention work, youth risk prevention work, cancer prevention work. However we can use our coalition for the better health of our community is important. So phases 1 and 2 are all about community mobilization, ownership, and how do we put the work in our community's hands to keep this work going and get it started. Phase 3 is assess the community. So what does our community need? We've already looked into that twice with the Healthy Kids Colorado survey, and we'll be doing it again in 2021. Make an action plan and then implement and evaluate that action plan. Okay, the importance of coalition work. I know I already touched on this, but I'm going to touch on it again. This is a breakdown of why coalition work is so important, especially in our small communities. So it's about efficiency. How do we make this work impactful and best for everybody? Cohesion, how do we all work together? Opportunities for participation. So how does everybody share the work, enthusiasm, and resources? And as you see, this is an infinity sign. So the work just keeps going and going and going, okay? So obviously this is not going to be a Band-Aid fix. It is going to be something that we all need to sit down, come together, and create solutions for our community for years to come. The risk and protective factors that were prioritized according to the Healthy Kids Colorado survey, which is a survey given to junior high and high school students, are number 2 prioritized risks were norms favorable to substance abuse, which was about 10% higher than the state average, and then early initiation of substance abuse, which scary was almost double the state average. So is anyone confused by that? It means that our kids are starting substance abuse younger and younger, and it's double the state average. And remember, this is going out to junior high and high school kids, so kids as young as 13 are taking this survey. The number 1 strategy that we picked to help our protective factor is promote the positive youth development strategy and the social development strategy. All right, so the positive youth development strategy, yes, is about us as adults and how we connect with our youth and how we start bringing them to the table to better be engaged as equal partners. And also it is important to bring them to the table to keep work sustainable. Obviously, we all age. Okay, not a fact we all want to admit, but it happens. Okay, if we don't start bringing our youth in to help with this work, it's not going to be sustainable. Also the social development strategy, both of which I am trainer of positive youth development, so I will be continuing those trainings on throughout the year. Social development strategy is how we connect to individuals and how we create better, clear understandings and how we communicate better with each other to help with our collaboration, cohesion, and keep the work going all together. All right, working together, next steps. This is where Allie was like, hey, Autumn's gonna touch there. Yeah, so tobacco prevention. I actually just finished my tobacco prevention facilitator training about 2 months ago. Hopefully I'll get that up and running soon. But the main work is to talk to individuals, to have them come into public health, to create a quit plan, talk about how important it is, and how a lot of health factors that are included with tobacco use can actually be reduced even just after quitting. So I think it's important to educate, promote everything. So build, I'm gonna pass this back on to you now.
Yeah, sure.
Yeah.
So Andy kind of has already touched on this for the ways that we can really collaborate and work together at the state level, from the Front Range, and on the plains. So building public support, communication, and outreach. So I brought a whole bunch of papers with me that talk about all the different risk factors, all the different cancers, all the different cancer screenings that you guys can share within your communities. If there are certain things that you need, Autumn, as you're working on this, you can reach out to us. We're happy to support. Number 2, funding. We all need it. So, and we know that certainly in rural communities, there's definitely a need for additional resources. So from the coalition standpoint, we want to make a commitment that we will look out for funding opportunities, provide funding if we have it, and continue to support outlying areas outside of the Front Range. Build public support. So I think Autumn, what she touched on as far as coalition building within your community and really making sure that everybody is kind of on board and agrees that this is something that we need to work on and something that we need to make a priority. And then improve and sustain. So as we know, it's not going to be a Band-Aid. It's going to be something that's ongoing, that we need to continue talking about, that we need to continue having programs for. Cancer prevention and cancer screening aren't one and done. It's something you have to continue to do throughout your whole life. And so figuring out how we can build those policies and those sustainable programs to keep everything moving. And then like Andy mentioned, we want to help you do that. And then we want to go help someone else that needs that help too. So if we can develop sustainable programs that you guys can keep running, then we can go help someone else somewhere else. So I think that is all that we have.
So Keith, are we able to pan to the crowd as well as we're, okay, great. So huge round of applause. Autumn was so nervous, but I have to tell you, kudos. Say hello to all those 200 people on the TV. Yay.
First public speaking.
Yay. So I think it's huge though, that when I look across this room, I mean, even for our coalition work, which Autumn, you're right, for our cancer coalition, we've been at it for 20 or 30 years. But when I look at who's here right now, business community, Cindy and Brittany, I mean, with the work around cancer support and survivorship, really thinking about how do we bring families and support families who need treatment, whether what we do here or in the city, this is huge. Greg and Angie, board members of the hospital, banking community, Shannon, the regional health connector, who's really also gonna be working with us, Maggie, I mean, a nurse provider who's here. We've got Phil and Debbie. If I keep on this name situation, yeah.
You guys want to introduce yourselves, please?
But my point is this, is that as we go through with Phil and Debbie and everyone who's here, from the business community to Representative Rod Pelton, to many of you who are also working in the Tobacco Coalition building, this is actually a stronger building and coalition than we have sometimes in all of our coalition work that we've been doing for 20 or 30 years. You guys have this here. Like when I look at in the room, this is really impressive. So I just want to say a huge kudos, because I know this is actually what we're aiming for. If you guys can stick together for this sort of work, Cheyenne County is definitely going to go from that number 2 to very low for our cancer work as well as that exposure. But yes, congratulations, good work. So I think we have some time for some questions, and I know everyone's wearing multiple hats today too. So any questions or thoughts about the work?
We appreciate all your help as you stepped in and helped us out, Cheyenne County.
Awesome, thank you so much.
Has anybody given any thought to the two, Cheyenne and Jackson County, did you say?
Mm-hmm.
What do we have in common?
That's a really good question. And I think we've had some conversations with our epidemiologists and folks at CDPHE to say, what do we look at possible causation? What do we look at common trends? I think it's something that we're going to explore. To be honest, I think what's hard is our absolute overall numbers in total are smaller because we're, per capita, a smaller group. It's harder to study causation when you have small numbers, but I think it's something that we have to consider, especially if we start to see certain type of situation that happens to cluster. But here's something that's huge out here. I mean, there's a ton of melanoma, there's a ton of skin cancer, and we know that's also exposure risk. And I think Jasmine and others mentioned this well, like we have some of those resources in Cheyenne County for that kind of prevention where we know what the problem is right now. So if we can use hats, Cindy, it's lovely. I've been commenting all day. That hat is killer. The sun bus. Yeah, basically looking at those hours of exposure, mammography, colorectal cancer screening, lung cancer screening. I mean, you guys are killing it out here. There's very few rural communities that have low dose screening that's available. So Keith Memorial Hospital and that work. So Kathy, I think what I would say is for some of the ones that we know are probably the higher, we know what's causing that. So if we can do something about it, great. But I do think your point is well taken, that if we start to see some similarities between rural communities particularly, we need to really investigate that. So, and that's something that our state health department data teams, as well as our epidemiologists at the university and statewide can really look at. So if those are questions that are coming up, like let's have some discussion about it and see what we can do. So love the question.
Is there any way to get to insurance companies? I mean, you got the colorectal changed, but I know there's people here in their late 20s and stuff that have tried to get mammograms because they've had a low insurance with paperwork.
Do you want to talk about, you guys can both talk about the.
No, I actually don't know. Ask me to repeat the question.
Oh, ask answer.
Oh,
Okay.
So Cindy's asking if someone is younger than the screening guidelines and has some symptoms, if there is a way to work with insurance companies to cover that. So yes. So we have at the American Cancer Society, our sister organization is the American Cancer Society Cancer Action Network that works on all of our policy work. So that works to change screening guidelines, to work with insurance companies to change their policies. And so, yeah, I think that's something that we're kind of always looking at. We just saw colorectal cancer go from starting at age 50 to now at age 45, because we're seeing an increase in younger colorectal cancer patients. And so I think that's one thing we're always looking at is, are these the right screening guidelines? We just saw the age go down in lung cancer screening also. So I think that's something that we're always kind of looking at is how can we make sure that we're screening people at the time that they need to be screened.
And I think your point, and this is something that the coalition is working on as well, is really looking at employer opportunities to understand different types of coverages, how to advocate for preventive services that should be covered. But I think that out-of-pocket costs for symptomatic and young people, it's a really big barrier right now. But I think those are things that we can hear feedback. Keith and Catch It in Time team are doing a lot of our production, so round of applause for all of them. But when we have these videos and really share with our legislators, I think Rod can attest that really hearing from your constituents and sharing with policymakers about what's happening, this really does make a difference. And so I think sharing through all of our work, the many of us who are trying to do this work together, we can talk about how to advocate for the issues that are most relevant to Cheyenne County. I think symptomatic out-of-pocket costs, as well as looking at insurance coverage and what people are eligible for and what those plans shouldn't cover. Those are things that we're going to be working on. And I know I had policy listed as one of those initiatives. So those are some of the things. Rod, Perry Will, and then Senator Sonnenberg were actually very supportive of a bill that we had that unfortunately went down right before COVID. But we were also trying to really reduce that out-of-pocket cost. So if you had if you had a stool-based test, so if you did stool DNA or a FIT or FOBT and it was positive, and you went to go get a colonoscopy, even if you were age eligible, it was about $2,500 out of pocket. So we were trying to make sure that we really reduce that sort of situation, because especially in rural communities, we don't necessarily have an endoscopist available. A FIT and FOBT, a stool DNA test, it's a good test. But if you have a positive and have to shell out $2,500 and then drive to Denver, that's a big lift. So those are the kind of things we're going to continue to work on. So as Autumn said, even with our rollout of the things we're doing, we really want to see what we can do to support the things that we have, where we're going. Jasmine has talked about even how do we look at better treatment services out here. So we're iteratively going to be looking at what are those policies and priorities and work with all of you then to help advocate around that. Okay, Ashton, did you have a question?
I was just curious, like, so I work in school, so youth engagement, and like if people come to you and are like, hey, how can I help? Like, how do we do this? How do we direct them to help it? How does it work?
Okay, so you're asking when individuals come in, ask, how do I help? Where do I go? The first place they're gonna go is probably to me at local public health, and I will try to be more adamant about going into the schools to talk to them as well. But come to me so I can find out exactly where they want to help, where their passion's at, and then lead them from that.
And then Ashton, I think one of the things that Allie and I have also talked a little bit about, and we met with Tori Brown and the school, we'd also really like to engage youth, of course, in health, wellness, and prevention. But I think we're also really thinking about career building. So how do you have a position in local public health or in the medical field, or what does that look like? And it doesn't necessarily mean researcher. It doesn't mean public health program implementation specialist, local public health. It's Keith, right? Keith is a guy who sits behind the camera, does amazing things. Keith, do you want to turn the camera and like give yourself some accolade right now? But Keith, if we didn't have Keith, who was an amazing communicator who's worked for, he and Travis worked for ESPN. We worked with, what all of you worked on, Keith? Discovery, right. So he took all of these skills and started to really think about how does he become a health communication specialist, a grant specialist, thinking about a legislator who understands health policy. we're really thinking about how do we also make those connections for kids to really think about how do they grow in health profession, even if it isn't a doctor, nurse, or researcher. There's so many things that you can do right now, building apps, I mean, there's so many things in the world, in the digital world. We're gonna be trying to make some of those connections with health specialists, health professionals coming from the city, bringing kids back and forth, but it also doesn't mean you have to leave your community to do it. So if you live in Cheyenne County, you want to come back, but you're really stoked about this sort of opportunity, like let's think about how to keep it home, bring it home, and then continue to make our community really vibrant in this work as well. Any other thoughts? Right.
So thank you for being so involved in bringing the light to frontier rural counties and communities. Without voices like you, what is your opinion on what would happen to us out here as opposed to
Well, Rod, I'm going to have you take the mic because, okay, so Representative Pelton's question was if we don't have strong voices coming out here and advocating what's happening. So I'll tell you what's happening. I work at the national level. I work on federal level grants. Allie watches this too. Extinction will happen. And I think I had a slide in there. I'm not sure I actually got to it, but the vitality of this work will keep Main Street open. So I think about if the women's health clinic, right, leaves, that's people who don't frequent the bank, who don't frequent, which was Nan's before, or the chicken place or the Gap. That isn't people who's coming to the pharmacy. Schools will drop. I mean, I really do think if healthcare leaves rural and frontier communities, it's not coming back. I'm gonna be honest with you, it's not coming back. We gotta hold on now. So there's a lot of different things. I'm not going to get political here because I will get fired, but which I sort of border almost weekly. But anyway, I just what I would say is that what I say is like right now, we know there are different health systems that are buying small hospitals, which is great because they can help with that vitality. But that's not going to be the solution for everyone. So if Keith Memorial, local public health, the Kit Carson Clinic, as well as the Cheyenne Wells Clinic doesn't stay, like I think it will really be hard. We've got some amazing opportunities. I think we know that with COVID relief, there's some things that we could do. We all have to stay vigilant, but I think as much as you're thinking about your farm, or you're thinking about the ranch, or you're thinking about your independent business, if all the rest, and you guys know this better than I, if it doesn't stick, then we all go down. But really for healthcare right now and what's going on in the Front Range and some of those discussions, if we don't advocate hard, we probably will be looking at even primary care delivered in a van, and we don't need that. It's great for the Sunbus, and those are great things, but we need primary care, and we need people come back and to really be engaged here. So I don't know, Rod, if there's anything else you would add to that.
Not really, except there is a push from the Front Range crowd to make us all telehealth.
Yeah.
And I advocate that it's a great tool to have, but we cannot replace the in-person provider.
Exactly. So the comment was telehealth has a place. I think we all agree, and especially post-COVID, we don't want to see it go away and have reimbursement for that. But if we don't keep people here doing this good work, the primary care providers, the nurses, the technicians, many of you who are on the hospital boards and leadership, like it could really go away. The next 5 years are going to be critical in healthcare in rural and frontier in Colorado. Yep. Okay, other thoughts? I'm going to give a plug for Patty and the survivors in the room. So if you guys want to raise some hands right now. One of the things that we have, support groups are hard to keep together. When Allie and Adam and I were talking to the team, the idea that there's 10 to 15 survivors that routinely meet and advocate, I think that's something that's huge. We really want to continue. Prevention goes so far, right? But there will be diagnoses, and there will be sporadic cancers that we have no idea. So many of the cancers, we don't know why they're caused even. So I would say that moving forward, really supporting survivors, a time to meet. Mental and behavioral health is also something that I know Shannon with the Regional Health Connectors and the AHEC, they're doing a lot of great work. We really do want to support our community at large. Caregivers, people who are survivors as well as caregivers need that support. We will try to bring more of those resources. Last time we were here, we had 2-3 other people. Allie and myself will keep coming. There are a number of people who are on the Front Range who are really, really excited about today. They're excited that there's 40 of you in the room. They want to find a way to really engage too. So I would say as much as we need to advocate because there's a lot of limited resources, there are people who really care and who want to be a part of this. So for the survivors and folks that need that sort of support, we are talking about quarterly meetings where we'll Zoom information in, we'll meet, we'll bring specialists down as well to help support. And what I would also say is that if you guys need that kind of support for cancer prevention work, Allie and I are here to help. Clinical trials, looking at Airbnb, we're trying to look at how do we create an opportunity with Cindy and Brittany and team to really think about a place for folks to stay while they're in the city, creating those sort of opportunities. So supporting our survivors and caregivers is something that's going to be critical too.
I'm only coming back to do a celebrity pink contest every time I'm there.
Allie Bain is going to be
Nominated.
yeah,
I have to tell you, I have learned more about the variety of contests that you guys come up with. Like chicken barrel racing, I didn't know that was a thing. I saw some turtles race, I'm not even kidding.
Yes. And I think that, you know, Bert Gutierrez and his family, that the proceeds are going there to support him as a young survivor. That's amazing too. So Odd, anything else? Do you want to round us out? Unless anybody else has any questions?
Yeah, any more questions? One more.
Yes, do we have I don't think we have one in our community in that where they have a support for the ones who have to help the ones with cancer or after their death to cope with that type of situation in that, so that we don't have to drive, you know, to Denver or to another state or whatever. And that, because I have dealt with cancer for 15 years, and I just never have ever seen anything offered for, yes,
And
yeah.
support. And Shannon, I want to put you on the spot. I will say this, and I'll turn it over to Shannon to introduce herself and share some resources. But I would say Senator Sonnenberg couldn't be here today. He tried, but he did do a video, and he talked about these very components. So I know that that's something, Rod, that's being advocated very strongly is mental behavioral support for people at large, but also for chronic disease as well as support. So yes, but Shannon, this is something you guys are really working on right now. Is that correct?
It is one of the areas. I'm Shannon Bors. I'm the regional health connector with Centennial Area Health Education Center. I actually cover Kit Carson, Cheyenne, Lincoln, and Elbert counties. And basically what I try and do is to bring resources to those counties. My organization actually covers all of Northeast Colorado. There's 11 counties. But one of the partnerships that we've been working on is with Lifespans, and they're a mental health provider. And they have a really good, even before COVID started, they offered telehealth options. So because, you know, the brick and mortar and mental health care is just extremely limited out here. And as a regional health connector, I can actually write referrals and help you get connected with them. But if you guys are specifically interested in looking at some bereavement, we can work together to make that happen in this community.
Definitely. And I do think the support, you know, particularly of caregivers and people who've lost, it's different than being a survivor. I mean, we've heard that a lot, is that that can be a very different experience, and people need something. Shannon.
Yes, I've been on both ends, so I know what it is, and it's it makes you stop and think.
Let's definitely connect after this and sit down and kind of start to strategize what that might look. To me, I grew up, my parents were foster parents, and it sounds almost like that respite care in foster that you're on, you know, that support network. So definitely have some familiarity in how to build those kinds of networks. And so I'd be happy to talk to you and figure out how that might look.
Connections. I guess, are there any more questions? Comments? Nothing? All right. Well, I just want to thank everybody for coming out here, and that I think we need to keep this enthusiasm going and these connections again going for further work and really start to see the change in Cheyenne County.
It's time for a group hug. If that's okay.
It's hot. It is so hot.
Actually, people
I
got
like
real
you all,
uncomfortable
but-
for a variety of reasons. So, all right. Well, Autumn, thank you a million for having us, and just want to commend all of the great work. So thank you guys so much for coming out.
And I will again thank Allie and Andy, all these A's, Allie and Andy, and then our community, and then everyone else behind the scenes. Thank you so much for making this happen in our small area. So,
Yes.
Thank you so much,
All right.
everyone.
Bye, guys.
all right. Thank you, Doc. Yay.